That is joining us this afternoon. I am Eltina 3 Stars. I am the new program manager of the Circles of Care program. And I don't know if Rebecca wants to step in here really briefly here, introduce herself.
I'll begin. Hi, Rebecca Leslie, and I work with Eltina as a project director on her program, as well as the behavioral health clinical program director. Thanks for having us today. I'm going to pop out, so I'm here right beside her.
So just to begin, the Circles of Care program is a 3-year program. It's a SAMHSA grant. And with that, the ultimate goal is to provide better mental health and behavioral health services, as well as access to getting those, looking for the areas where there's gaps in the community, say that we might be missing, looking to get feedback from community members who utilize those services. And it's not just mental health, behavioral health, it also includes substance use as well. So those that are seeking treatment and those kind of services as well. Ultimately, our goal is to get out into the community, do assessments, surveys with community members, as well as partnering companies that we look to build partnerships with in the community that provide services, and kind of get a better idea of where everybody's sitting at and where they feel comfortable and where there's gaps in that care. With that, we are also, those partnerships that I was talking about in the community, we're also doing community and provider surveys for those as well. And we're looking to make sure that the providers, those that are providing that care, are adequately trained and they feel adequate in providing that service. So a lot of this also provides trauma-informed services and making sure, that our providers with Oyate Health Center and the providers within the community feel good with providing those services. And so basically the idea behind this grant is to make sure that we're streamlining our processes, that we are working on a system that's very collaborative. That way our relatives that are seeking care aren't falling through the cracks in the system. And so ultimately, that's like a really brief overview of the programming and what we've been doing. However, there's a lot of pieces in play right now. So one of our first initial steps was obviously establishing a advisory committee that would oversee this grant. And that includes 10 members right now. And that advisory committee includes people with expertise in that field. So we've included Dr. Marilyn Zimmerman. She has expertise in trauma-informed services and training. And so that's where she comes into play. We have multiple members from different tribal communities, such as Cheyenne River and Oglala Sioux tribe, as well as looking to include other tribal members for their input as well. That way we include tribal members that utilize the services here in Rapid City. And we also include the youth. We have currently one spot is filled with the female youth, and we're also looking to recruit a male youth. And those youth are individuals that have utilized the behavioral health services in the community. So they can really provide us some feedback and let us know where they're getting their services, how they're doing with those services, and if they feel like there's certain areas that are lacking. So when we have these advisory meetings, they can, just hear what we're doing, and then they would know and provide that input, like, have you tried this? Or we think you should maybe bring these surveys out to this area, just kind of to help us, give us some better ideas. That way we're not, siloing ourselves to just this program, and we're reaching a wider audience in the community. And so that advisory committee meeting, we've been having monthly meetings. And so we've been getting a lot of positive encouragement and suggestions along the way with the group. And so that's one of our, I guess you can say, deliverables. Those that work under grant programs, you're kind of bound to your grant deliverables. And so to make sure you're meeting those monthly or quarterly quotas. And so that's something that we really wanted to make sure within our programming is to make sure we have that feedback. And part of that is actually being able to go out into the community. And so with that, we've recently been given permission through our IRB approval board to actually go out into the community, to ask those questions, to start doing that data collection piece. And so beginning this week, we're going to go out into the community. We are partnering with a local Native American nonprofit organization, I Am Legacy, and they are having a 4-day ceremony. It's strengthening kinship, and the health board is partnering with them. And so we'll be there to provide counselors, behavioral health services wherever they need us, because they will be having talking circles as part of this community healing event. And so we'll have providers providing that. And then the Circles of Care program, we're going to be looking to introducing those community surveys to our community members. And our goal target is 200 people. We want to be able to reach at least that many people from, family members and youth that look to utilize these services in the community and get that actual feedback of the individuals that may or may not even be utilizing behavioral health, but do struggle with those issues. So.
This is Rebecca. I just wanted to add to what Eltina is sharing about this grant allows us to also look at culturally informed care and our, other providers needing support and help in that area. One example that came up just last week that I wanted to share was one of our employees took a relative to an organization here in town for some services, and they approached him in a way that wasn't trauma informed. They were rough around the edges and expressed kind of just frustration with this individual. And so that's a great opportunity that we're going to be able to utilize this grant funding for, is looking at organizations like that we can help train that front line person, that person that has that initial contact with our relatives, and how to approach them in a welcoming way that will open them up to trusting so that they can truly be helped. And so I'm excited about that part, that we will be able to reach out to that organization and offer them training and offer them support. And seems like you're real frustrated as individuals come in and are asking for your services, and to survey them and support them in positive growth. And we're hoping that we can change some policies and procedures within our own facility as well. And we were able to do that just recently, where we had relatives coming in for behavioral health services here, and immediately they were asked to fill out all this paperwork and some screening tools. And it's brought to our attention that's not trauma informed care. And so we're able to now have our practitioners gently introduce those screening tools to our relatives and walk them through it and ask them the questions, instead of just overloading them with a new experience already, and then asking for all this information before they even see someone. So I'm really looking forward to some changes that can happen within our organization and within the community. Thank you.
Thanks, Rebecca. So I want to touch a little bit more base on that. So as you'd mentioned before, Shannon, ultimately the goal of the Circles of Care program is to, reduce those gaps, stigma, barriers, and biases when it comes to accessing behavioral health services and, substance use. So for us, if we can reduce barriers anywhere that we can currently within our programming, we're looking to get rid of that. So like the referral process, a lot of organizations, if you want to be seen in a specialty area, you have to get a referral, and that has to be approved through your insurance or, whatever the process may be. With us, for, our relatives, we want to make sure that is not a barrier for them at all. And so our way of doing that, implementing that almost immediately, is to let them know there's no referral. You can walk in the door, you can call our building. If you want to speak to somebody here, kind of get a better idea of what the system, what we provide for services. That way you don't have to be referred by a provider to our services. And that ultimately was like a big thing for us, because that reduces so much, the barriers that most of our relatives see when it comes to getting help that they need. So, and with that too, is reducing the stigma piece too. If you can openly talk about it and openly say, yeah, oh yeah, I use behavioral health. Yeah, just give them a call. Like that, just open that free flowing conversation, I think is kind of allowing, our community members to not have that shame that comes with utilizing these services, and being able to see that it's just, if you need help, come get it, type of situation. And that would really help our relatives in the long run. So yeah, thank you for touching base on that, Rebecca. Another piece of this, and it's a big piece, is accessing resources in the community. So there's a lot of resources in the community that provide, these services that we're looking to provide. And so it's unfortunate that a lot of our relatives in the community don't have access to these resources. It's not freely accessible. It's, they know they're there. It's not easy for them to go here, to go there, or to do all of this research. And so part of our programming right up front was to get a cumulative list of all the resources in the community, not just behavioral health, not just for, substance use disorders, a list of all of the entities in the Rapid City area that are providing services to the community. That could be for transportation, that could be for rental assistance, that could be for clothing or food, it doesn't matter. Our goal is to collect all that information and to compile it into one database. So we've actually worked with several organizations in the community. 211, the helpline has been one. We've reached out to a couple of other organizations, and they help to collaborate with us with this list. So we share our list with them, they share their list with us, and to get that information so that when our relatives come in and they're seeking help, a part of that case management piece is being able to provide them not just those behavioral health services, but also those other services that they're needing. Because sometimes we forget that it's not just behavioral health issues that they're dealing with. Maybe some of that anxiety comes from, hey, I have rent coming up, it's due, I'm broke, I don't have a job right now, I don't know how I'm going to make ends meet. And so people got to kind of understand that people, we're a whole person, emotional, physical, spiritual beings. And so we got to remember that piece comes into play when somebody comes in for those issues. And so not just treating, them with medicinally or, with just counseling or therapy. We're trying to treat them, holistically, and even in a spiritual with that culture piece too, as well. So our biggest goal is to make sure we can help alleviate any struggles that they're going through while they're going through the main focus with the circles of care are where our target area is. So with that, we created a resource list that we've sent out to community providers to make sure that list is 100% accurate, I guess, so to speak. And then we'll be launching that out into the community. We'll be having our own in-house, so we can print off, if you're just needing help with this specific category, we can print that list off, and that will give them that information that they need, and also help them to feel empowered too at the same time. I know some people, it's really hard for them to seek services, to seek help on top of other issues that they're dealing with. And sometimes we just kind of want to alleviate some of that that stress that they're already going through. And you'd be surprised how many people just need one person to listen and to care, and by, hey, here's this list of resources, and having them call can kind of help alleviate. They already have all the stuff they need, it's at the tip of their fingers. And then helping them along the way, meeting them where they're at is basically what we're trying to do. And that's been one of our mantras in the building, is meeting them where they're at. And so making it as easy as possible to get in for services, making it easy as possible to streamline those services, and gaining access to those resources that we might not provide, but other entities do. And so we're building upon that, signing those memorandums of understanding with organizations in the community. So there's a free flowing process of exchange of information. So they know we're working with them, and they trust us. And so we can, help them help each other. And so that's another thing that we're working on. And with that, we have a lot of partners in the community that kind of realize that maybe they aren't so up to date when it comes to trauma-informed training and providing that care. You can be trauma-informed, and it's one of those trainings that you get over and over and over again, but we really provide an indigenized aspect to it. And so we can incorporate that cultural piece, especially since a high population of our Rapid City users are Native American. And so it's really good to make sure that these organizations in the community are aware of, historical trauma. They are aware of that generational struggle, and that helps them to provide better quality of care. And we also do this within our own organizations too, as well. So we're not just training other individuals out in the community. We're also making sure our Great Plains Tribal Leaders Health Board staff is trained. We're also making sure our Oyate Health Center staff and the providers are also trained. That way we're all on the same page about how we're providing care to our relatives. And if at any minute you have a question or something, you guys are welcome to interject, and I'd love to answer your questions too as well.
I actually just have a quick question, Eltina. When talking about, and Rebecca also mentioning, like trauma-informed care and culturally informed care for the Rapid City community, but if there's other organizations within other parts of the Great Plains area that's interested in maybe getting that training for their staff organizations, is that something, your program can provide for other areas outside of Rapid City?
Yes, definitely. So we are accessible to, the 18 tribes that we service within the 4-state region, South Dakota, Iowa, Nebraska, and whatever state I skipped. Yes, we that's part of our service area. I know a lot of people probably think we're completely solely focused in the Rapid City area, but a lot of what's going on in the Rapid City area is kind of like the pilot project, so to speak, for a lot of these services that we're looking to implement statewide and into the surrounding states. And so a lot of what we're doing here is kind of like, this is the area where we get to test it. And if it's working here, this is where we would love, for those other tribes to express their sovereignty and be like, they're doing it, it's successful, we want to do it here. And so that's why we really stress the importance of getting that community feedback and buy-in, because everything we do has to come from the people that are using the services. As much as I would love to be like, here, this is going to improve the process, here, do this. You got to ask the people what they want. And be able to listen to what they want and then implement from there. So that's what we're doing, is trying to get, and we hear, basically, we're going to ask, we hear you. And so basically when you ask, you have to do something about it. That's what I've been told. And so that's our goal, is to make sure we're listening to, our relative shareholders. That's ultimately what they are, is they have a buy-in into this. This is their healthcare system. And so we want to make it the best that we can. And so we have to be open for improvement. And part of that circles of care piece is where we get a chance to listen and you know, in the next 3 years, if we get the second part of the funding, we can actually start implementing a lot of the stuff that we've heard back and got feedback about. So, but I think the good thing about this is a lot of the stuff we've been able to implement some of this stuff and already start the process. So we've been working, the behavioral health side has been working with other programming under the health board as far as providing cultural services and intervention. And a lot of that has to do with that spiritual piece, with healing a person, and a lot of that has to do with, gaining that cultural identity back and healing from your traumas as well as generational traumas. And so for us, incorporating that piece and offering that piece of the culture back to our relatives, that is what our goal is to provide those services, on top of, Western medicine, if they choose to do that, they can use both, or, if they're looking to go a different route. We just want to be able to offer our relatives more options and what feels comfortable to them. And I know that we have currently, we've initiated that within another program within the WAY program. They've been initiating cultural intervention, and that includes, anything from, getting a Lakota name to getting wiped down from trauma to, calling back your spirit. And it's a beautiful thing to see, to see our people reconnect with their roots and reconnect with the culture. And so we're really grateful that we have individuals within the community that have that knowledge. They're willing to share it and they're willing to help our community heal ultimately. And that's a whole nother subject I can go on and on and on about. I'm pretty excited about because, not everybody grew up in that. But we know it's a part of us, it's a part of who we are. And so to be able to offer that missing link back to our relatives so they can feel connected, so they can feel like, okay, I'm not going crazy per se. They can reconnect with that and in turn help themselves. And I think that's part of it is the behavioral health department is only a tool. And it's only a tool for people to use as much as they are willing to use it. And so our goal is to maybe give back and empower our relatives to want to seek that healing out and in whatever way feels right for them. And so definitely that cultural piece is a big piece of it. And I know that our relatives are super excited. The ones that have heard about it so far, they're definitely getting the referrals are coming in now. And so we're super excited to be able to help our relatives with that.
Just the fact that so many referrals have started so quickly tells us that that's a gap. And so I'm looking forward to continuing that work and identifying other agencies are excited about, oh my goodness, you all have cultural interventions. How do we get to you? How do we get this service to the people that we provide care for? So, and Eltina also has taken the lead on getting an NEPI set up here right on site. So we'll have our own NEPI. And we do have the good fortune to have a cultural advisor on this project as well. So we are just really blessed and looking forward to expanding and hearing from the community what they need and providing.
I look at this as a really great opportunity to have our relatives reconnect as well as a lot of our staff. So a lot of our staff is Native American. They have that background. Some of them already know the culture and already partake in this. And some of us did not grow up with it at all. And it's, we're aware of certain things, but we're not aware of the protocol that comes with it, or, what is what and what means what. And so it's an opportunity for us as well as, staff to learn about our own culture, and help others learn and incorporate it into ours and their lives, as well as helping us on our own healing journey. Because believe it or not, a lot of people who are in behavioral health, obviously somewhere along their line struggled with it in their lifetime. Same thing with that substance use. If you struggled with it or you saw somebody that was struggled with it, it affected you and came across your path sometime in your life. And so a lot of the people here have been affected some way, somehow by either behavioral health, mental health, or substance use. And so our way of giving back is to be in these roles and to be helpers along the way. And some of us are, kind of helping to heal our own selves. It's really hard to not be triggered in this environment, but it's also a very healing environment that we're trying to provide here for our relatives. We have the opportunity within this organization to wazilia, smudge off the building with sage or, sweetgrass. And so we start our day like that. We start our day in prayer. We give thanks, we give gratitude, and we check on each other, making sure everybody's doing okay, because, part of being caretakers is sometimes you get burnt out, you're always taking care of other people. And so I personally, I made that my own little personal goal, is just checking in on the caretakers, making sure they're okay, because that's a lot to handle, to have relatives come in back to back to back all day. Making sure they're getting their breaks or they're staying hydrated. Did you eat? How are you doing? How are you feeling? Just creating a really good culture, a healthy culture of healing. And I think if we can emulate that and show that, and that this is a safe place, that'll help our relatives to start opening up and healing too. Because you can't come into a toxic workplace environment and feel uneasy while you're trying to do your own trauma work. And so our goal is to ultimately make this building that safe place for our relatives, where they can speak freely, and not have to worry about feeling judged or, that stigma that comes with it. And so I think what we have here is an opportunity from our leadership to really build this behavioral health system into something that we want it to be, and we need it to be. And that's really exciting for us because, in other organizations, you get a lot of red tape. And so things you can do and cannot do. And I know certain organizations, you can't burn things in. So burning sage for us was like, yay, we can. So yeah, and just acknowledging that piece. And being very open-minded. We understand that not all of our relatives here, believe in this way of life. They're not all Lakota. They don't speak that. There's different, tribal nations that come here and utilize these services. So we're just aware, and we try to be very aware that that's not always the case. We also have employees that are different from different tribes down south, and they let us know too, this isn't my belief system, but I think it's awesome that you guys are offering this. And so just trying to be open-minded enough to help people on their healing journeys is a really big thing within this organization. And I'm definitely grateful to be a part of that. So Rebecca, do you want to talk a little bit more on behavioral health and maybe, I don't know, about the services or anything else?
Sure.
Okay.
One thing that popped up too that you addressed was the stigma that goes with mental health. A lot of times it's not like if somebody has an illness and they go in and they get treated or they have an accident, and there's a lot of sympathy and a lot of people reaching out oftentimes. But with mental health, it's more like, oh, okay, what's wrong with you? Or yeah, a little bit awkward for people at times. It's looked at differently. It's not something you can see from the outside. So we also want to work on that stigma, and we have a lot of community members that feel like reaching out for help means you're weak, and we need to work on that. And reaching out for help oftentimes it takes a lot more strength than just continuing on in the same behavior patterns. So looking at education in that area is something that this grant's going to allow us to do as well. And as far as, Eltina mentioned the, behavioral health program itself, we're just building, we're starting from ground zero and we are building, and it's expanding quickly. We have psychiatric nurse practitioner here who was able to prescribe medication for mental health disorders, as well as doing therapy. We have a second nurse practitioner coming on board this month. So we're expanding that. We have a therapist here and he's booked out solid, and we have a couple openings for additional therapists. We offer telehealth services. So we contract with an outside agency to provide some telehealth. Some things recently that have been encouraging is that we're able to contract with a local psychologist that provides services as well. And that's a service that's in great shortage right now here in Rapid City. So having him on board has been exciting. Other services are the equine therapy that we're able to institute. And I know Eltina, you mentioned that, we don't have all that red tape, and yeah, we're able to just come up with this amazing, opportunity and then implement it. So we started some adult equine therapy groups, and we're working on getting a youth equine therapist up and running that we have on contract. So those type of things. We're able to have yoga here in our behavioral health building, invite community to yoga for no cost. So just a lot of opportunity for growth in such a needed area. And I'm trying to think what else that I'm forgetting very importantly. Again, Eltina mentioned it, the care coordination piece of like case manager piece of where it's not just about, you need medication for your illness and you need therapy. There are a lot of other factors that go into our mental health, including, our living situation, or perhaps parenting struggles, and does that individual need parenting classes or support in that area. So having a case manager on board is able to, meet a lot of those needs and help a person maneuver through the system of all the resources and connecting with the right resource and help them in the communication process. Because oftentimes, when somebody's suffering from a mental health disorder, it's difficult to communicate your needs. And so to have that person alongside of you that is able to advocate for you is a great opportunity as well. So are there any questions or?
I see there's one in the chat here. So I'll talk a little bit here. So the question is, when a provider is burnt out, what are some of the ways you help diminish that? And so I got to be, before I took on this program manager role, I was actually back and forth between Oyate Health Center and here at the Oyate La Crosse location. And my role was the case manager / care coordinator role. And for me, because I enjoy doing feel-good activities, was to kind of help lead the wellness activities over at the Oyate Health Center. And that was mainly for the primary care providers, the staff. And so for that, I was able to help with the help of several other people, implement activities to help reduce burnout. So we offered meditation. And so like Monday was meditation. Tuesdays, we offered talking circles, and that was open to staff who could come in and they can talk about whatever they wanted to do, or what's going on or what's stressing them out, or even talk about policies and procedures, issues that they're having with other coworkers. And it was a small, but safe environment where they could come in, they can share and they can vent or express where they feel like there's gaps or areas for improvement. And so that's something we held for the staff, so they don't have to keep that stuff inside. So they don't have to, go to work upset or angry that nothing's getting done, like these needs are feeling addressed. We also offered, if you want to call them concerns or question cards, employee feedback. And so we have stations for them to give feedback, could be anonymously. So that way, if they see something going on and it's not, being addressed, they can, write it down, put it in a box, and then HR or a quality assurance team would be able to address those needs in meetings. Wednesday, we had, let's see here, what was on Wednesday? Oh, Wednesday was a grief and support group that we started to offer. Last year, during the pandemic, a lot of our staff and community members, a lot of people lost people. There was a loss of, that whole, socialization piece. People were losing relatives to COVID. People were losing relatives to not to COVID, but couldn't even mourn them in a proper way. You couldn't, have wakes or funerals. And so people felt a lot of grief and loss over these past, almost 2 years of the pandemic. And so for us, we wanted to offer, a place where our staff could come in and, and talk about this through their grieving and their loss. Because what we realized is, in order for our staff to provide quality care, we got to pour back into them. They have to pour back into themselves, basically. And so that self-care was something that we really stressed in this wellness. And so we offered that grief and loss support on Wednesdays. And then Fridays, we took turns alternating potluck, because who doesn't love food? So what we did was more of, gather together, let's eat and acknowledge people's, work anniversaries, birthdays, just a time to gather and to get to know each other. So it's not always about work. And so just to give our providers time to bring something that they enjoy making, or, and share it with others. And that's part of that cultural piece too, where, our relatives would come together and share a meal together. And so incorporating that into a wellness activity. And then the health board also provides a 30-minute paid wellness break. And so that, that's something that they can take every day within their own, timeline during the workday, that obviously with permission from their supervisors, being that providers kind of have a harder time, they kind of got to plan it ahead of time because they see their direct care. So that one was just making sure that those individual people, are getting their wellness time in, but they're not doing it by their scheduling, isn't messed up. So, and I do know that I have heard in passing that some of our supervisors from here and Oyate Health Center both really encouraged some of those individuals taking PTO, that because, burnout is to the point where you're past your that point of self-care. And so, if a lot of our providers have a lot of PTO built up because they don't get to take it because, either we're short-staffed or they feel obligated to be there. So I have seen individuals encourage the, providers and individuals that are providing direct support to our relatives, encourage them to take that PTO off. And I really would wish a mental health day. That's why I wish people would with the stigma reducing piece is if you could even call it a mental health day. I'm taking tomorrow off, or, hey, I'm taking today off. I need a mental health day because, sometimes you just do. And to have to say I'm sick, in order to call out, well, then they're going to want to know, well, what were you sick with? Are you okay? And do you need anything? But really it's just needing some self-care. And so our goal was trying to lead by example. And so I tried to lead by example by making sure I put those breaks into my day to make sure I have a set lunch time. I literally block out lunch on my schedule, and that I get the pleasure or luxury of doing because I'm more on the admin side. Our providers, their lunch is designated their lunchtime. And so we want to make sure, you know, part of taking your lunch is getting away from the computer, getting up out of your chair, out of your desk, having lunch somewhere else so you can mentally check out. Because there's been many a times where I sat in a room and all of our providers are sitting there eating their lunch right at their screen. And it's like, no, you guys need to check out, and so for me, it's just encouraging it, practicing it and just checking in on people. And I know I'm only one person in this organization, but for me, it's just been a personal goal of mine to make sure people are doing it, because by me encouraging it, I'm also taking care of myself. Like, oh, I'm going for a wellness walk. I'll see you guys in 30 minutes. Anybody want to come with? So just encouraging it. And so I think doing that kind of helps want other people to do it. And so, like we mentioned, yoga, we offer yoga at both locations twice a week in the evening. So on Monday, Wednesday, we have yoga at 5 o'clock here at the Oyate Lacrosse location. And on Tuesday, Thursday, we have it over there at the Oyate Health Center, and that's for employees. And we've also opened it up to community members as well. That way they can see that, we're taking care of ourselves, you can take care of yourselves, that way it's there, it's being offered. And we definitely appreciate any feedback from the community. If there's a gap that they see for services that we aren't providing, if we can provide them, we would definitely look into getting that. So long-winded answer, but definitely encouraging provider burnout is one of our goals.
And I can add to that just briefly. We also encourage EAP services, employee assistance program, which the health board makes available. So you can access a counselor for no cost. Coming from a background of therapist myself, I've always advocated that each therapist needs their own therapist. So we really need to take care of ourselves. I don't want to go to a fitness coach who's obese and can't make up the flight of stairs without huffing and puffing. I don't want to go to a mental health provider that is not healthy mentally. And so we really need to focus on taking care of ourselves and walk our talk. That's something that we're just advocating for. It's not anything to be ashamed of, being a provider and needing to ask for help.
Thank you for that, Rebecca. Yeah, that's definitely one area that I think we're excited to offer is encouraging our coworkers, because coworkers, you spend majority of your time with them. It's your home away from home. And so when your coworkers are stressed out, and you can feel it, and they'll vent to you usually, but sometimes some of us aren't mentally equipped to handle some of the stressors that our coworkers are going through. And so just encouraging them to seek that care, just like you would if somebody walked in and they're needing a specific specialty service. You're not going to offer it up to somebody because you're not educated or licensed in that field. And so making sure our providers are taken care of too is definitely something. And I think we've been trying to help navigate everybody, encouraging that employee, the benefits of the organization, making sure those individuals get help, because the behavioral health department is a very hard place to be. A lot of our relatives are coming in and they're struggling, and they're coming to you to help with that. And if you're not in a good place, it's hard to provide that really good care for them. So just again, it's all tying in together, and we're looking at it as a group. But a holistic approach is understanding that providers are also human too. And they're going to make mistakes, and that they're also going to be struggling along the way. And so we want to make sure we're taking care of them, because our providers, some of them are also, utilizers of the healthcare system that we're looking to change. Let's see here. I got another question here. So Marilyn asked, are residents in the homeless women and children's shelters part of the outreach for services? So do you have a specific answer for that?
Yes, Circles of Care will definitely want to involve them and create a partnership with like Wavy and other domestic violence shelters or Cornerstone, and also have an opportunity to survey and ask questions of them. So to determine how we can best serve them and our community. So the answer to that is yes.
So within the behavioral health department, we do have navigators that actually do outreach, and we have the navigators that actually go out into the community and speak to some of our homeless relatives, and let them, ask them, kind of where they're at. It's that case management piece, but navigating them through the system when wherever they might need help. So, and it's with those same resources that I had mentioned before. And so behavioral health, ultimately, helping provide transportation, is one thing that we noticed there was a gap in. And so we assist in helping provide transportation to and from for those appointments. And some of our houseless relatives have been seeking behavioral health services. And so, they've made agreements, your appointment's this day, where can I find you? I'll pick you up. And so we've been coordinating those within the community, making sure that they're getting those needs met, as well as looking and that bigger piece, that case management piece, making sure that we're trying to help them with, finding a better, somewhere to stay, making sure they have access to these resources, food and all of that. So, and I do know that we worked with Wavy. Wavy's one of the organizations that shared their resource list with us. We were like, we're going to start building a resource list. They're like, we already have one. Don't do the extra work. Don't recreate the wheel here. So they were really willing to open and give us their resource list, and we just built upon that. And so, and just that collaborating piece, when they're working with an individual, all they have to do is email us or call us and let us know we're providing these services, but they also need your services, whether it's that cultural intervention or, counseling, therapy services. That way we are talking back and forth, obviously with permission, written consent, making sure they're okay with us communicating back and forth. That way they are in the know, we're in the know, and that way that open communication helps us provide better quality care for our relatives. So, all right. Any more questions? Anything else? Okay.
Yes, if anyone has any other questions for Eltina or Rebecca, the Q&A box is open, the chat box is open. And again, if you want to verbally ask a question, you can raise your hand and I can unmute you. I'm also just quickly, I'm going to put a link to an evaluation feedback form in the chat, just a place for you to provide any feedback, thoughts, comments on today's presentation. So that's available in the chat box. And again, this is being recorded, and we will be sending out a follow-up email. And with the permission of Eltina and Rebecca, we'll include their contact information. So if you have any follow-up questions or would like to get in contact with them, that will be available. I'm not seeing any other questions. I would like to say thank you so much, Eltina and Rebecca, for joining us today. This is a wonderful program, and it's so great to hear about it. It's so needed and important, and we really appreciate everything you guys do for our organization and for our community. So again, thank you so much for providing insight on this program.
Well, thank you so much for reaching out to us, and thank you all for your time and your energy. We definitely appreciate that. And if you have any questions, please reach out. I put our email in the chat, as well as if you have any referrals for individuals that are seeking any of these services, just send them over, have them give us a call, and we will definitely take care of them. So I want to thank everybody.
Wonderful. Well, thank you everyone for joining us today. Thanks again, Eltina and Rebecca. I hope you all have a great day and look forward to the follow-up email.
Awesome. Thanks, everyone.
Thank you.